Now we get to look at the pathophysiology of autosomal dominant polycystic kidney disease. So when you're talking about pathophysiology of any disease, you are trying to look at step by step to how this disease condition actually came to be. Okay, so for autosomal dominant polycystic kidney disease, of course, for sure I know that there's actually a mutation in the PKD1 and the PKD2 gene. They actually code for proteins known as polycystin. So let's look at it. Now, there's a mutation in some genes known as the PKD1 and the PKD2 gene. Now, this leads to what? The polycystin proteins that they usually code for is disrupted. So this disrupts the tubular cell signaling, how fluid is being secreted, how the cells proliferate, okay, and it now leads to cyst formation in the kidneys. It's a very nice picture which you can pause to observe and make meaning out of it. So, genetic basis, there's mutation in PKD1 gene, which was is implicated in about 85% of cases. PKD2 gene is implicated in about 15% of cases. PKD1 code for polycystin 1, PKD2 codes for what? Polycystin 2. So both of those proteins are very important. Okay, they regulate calcium signaling and tubular architecture. So cellular mechanism, now defective ciliary signaling, where there's loss of polycystin function, impairs calcium influx. So CAM driven cyst growth. There's elevated cyclic adenosine monophosphate. Now there's abnormal cell proliferation, there's altered extracellular matrix remodeling. Then we also have the cystogenesis, where there's now what? The development of cysts, which are now originating from the nephron segment. Okay, and only a small fraction of tubules will form cysts. So the cyst formation involves the tubular dilation, detachment of the cyst from the parent tubules, independent cyst expansion, which is fueled by fluid secretion and proliferation. Systemic manifestation is as the kidneys are getting affected, their functions are declining. So this could lead to hypertension, blood in urine, kidney stones, renal failure. Then it could also go to the liver, forming cysts in the liver. The heart could also be affected. Okay, cardiovascular rather, also the brain, where you're having intracranial aneurysms. Okay, you can also see cysts in the pancreas and also cysts in the colons.